TikTok changed the game. It made mental health mainstream, people talking about trauma, depression, ADHD, narcissism, healing, boundaries, self-worth, all in 60-second clips, sometimes with music and captions. And let's be honest, that visibility is powerful. People feel less alone. They learn words for their pain, they discover therapy exists, and that struggling doesn't make them broken. But here's the truth. TikTok gets some big things wrong about mental health. And if we're not careful, those mistakes can do real harm. Let's talk about it, clearly, compassionately, and with nuance. 1. Oversimplification of complex issues. Mental health is complicated. It involves biology, psychology, trauma, relationships, identity, culture, and more. But TikTok often compresses that complexity into 15-second bite-sized advice. You'll see captions like, if you do this, you have anxiety. People with trauma respond like that. This is your sign you have ADHD. You're not lazy. You're depressed. Now, those messages might resonate. They might feel validating, but that doesn't make them clinically accurate. Oversimplification can be misleading. For example, zoning out during class could be ADHD, but it could also be boredom, anxiety, sleep deprivation, or just being human. TikTok doesn't leave room for deeper assessment, and that's the risk. 2. Self-diagnosis culture. A growing number of people are diagnosing themselves based on TikToks. They watch a relatable video and suddenly decide, I have OCD, I'm autistic, I was gaslit by a narcissist, I have borderline personality disorder. Sometimes they're right, but often what they're identifying with are symptoms, not diagnoses. For example, intrusive thoughts don't always mean OCD, sensitivity doesn't always mean autism, emotional outbursts don't always mean BPD. Diagnosis takes time, training, and context. It's not something you get from a content creator, even if they mean well. And when people self-diagnose without professional input, a few things can happen. They take on a label that doesn't fit. They might start avoiding responsibility, thinking, this is just who I am. Or worse, they miss the actual issue that needs attention. 3. Trauma talk without trauma. Training. One of the biggest TikTok trends is trauma content. Creators talk about signs you have unresolved trauma. Your inner child is crying out. That wasn't love, it was trauma bonding. Some of these insights are beautiful. They've helped people reflect, heal, and feel validated. But here's the concern. Not all trauma content is grounded in clinical knowledge. Some of it uses trauma language incorrectly, confuses normal stress with PTSD, promotes repressed memory theories without evidence, or frames every breakup, every boundary, every emotion as trauma. Trauma is real. But when everything becomes trauma, we risk watering down the meaning and ignoring those who are genuinely suffering. 4. Pathologizing. Normal human behavior. TikTok sometimes takes ordinary human emotions and frames them as pathology. For example, you're overthinking, you have anxiety. You want time alone, you might be dissociating. You don't like loud noises, that's sensory processing disorder. But sometimes, you're not mentally ill, you're just tired, introverted, stressed, or going through a rough patch. Not everything needs a diagnosis, and framing every emotion as a disorder can lead to over-medicalization, where people start to feel broken when they're actually just human. 5. Algorithm over accuracy. The TikTok algorithm rewards content that performs, not content that educates. That means creators are often incentivized to use bold claims, oversimplify diagnoses, tell dramatic personal stories. Use emotional hooks like, if you relate to this, your childhood wasn't safe. That doesn't mean creators are trying to mislead you. Many are sincere, many are survivors, many want to help, but the algorithm favors virality over accuracy, and that can flood your feed with content that feels real, but isn't necessarily rooted in evidence or context. 6. The rise of mental health aesthetics. There's a trend of turning mental illness into a kind of aesthetic, a vibe. You'll see. Sad girl edits with soft music and teary eyes, posts romanticizing insomnia, dissociation, or numbness. Quotes like, I'm just a broken soul trying to feel something. Again, some of this is honest expression. Art helps people process pain. But when this becomes a trend, a mood, we risk glorifying suffering. Mental illness isn't poetic, it's not beautiful, it's messy, hard, and often invisible. Turning it into a fashion or content strategy can trivialize real suffering. 7. Influencers. Acting as therapists. Some creators on TikTok give direct psychological advice, without any credentials. They say, if your mom said this, she's emotionally abusive. You need to go no contact. This is what healing looks like. And again, they may be right in some cases, but mental health isn't one size fits all. What works for one person could be harmful to another. And the danger is this: people may follow these accounts like their therapy and never seek actual help. That's not empowerment, that's risk. What TikTok gets right about mental health? Now, let's be fair. TikTok has done some amazing things for mental health. It's made help feel accessible. It's normalized therapy and medication. It's helped marginalized people share their stories. It's created community. It's given people language to describe what they feel. For some, a single video gave them the courage to finally ask for help. That's powerful. That's good. That matters. But with great reach comes great responsibility, and we all, creators and viewers, need to stay grounded. So, what should you do? If you use TikTok and consume mental health content, here are a few gentle suggestions. 1. Be curious, not convinced. Just because something resonates doesn't mean it's a diagnosis. Use what helps, but don't box yourself in. 2. Check the source. Is the creator a licensed therapist, psychologist, or psychiatrist? Or are they speaking from personal experience? Both can be valid, but they're different. 3. Avoid self-diagnosis. If you see something that feels familiar, bring it to a professional. Don't try to treat yourself based on videos. 4. Balance your feed. Mental health content 24/7 can be overwhelming. Mix it with joy, art, humor, education. You're more than your pain. 5. See a real therapist. TikTok isn't therapy. It's not trauma work. It's not crisis care. Professionals exist for a reason, and you deserve that care. Final thoughts. So, what does TikTok get wrong about mental health? Sometimes it simplifies too much. Sometimes it sensationalizes. Sometimes it substitutes storytelling for science. But it also gets a lot right. It opens the door. It starts the conversation. It tells people they're not alone. The goal isn't to cancel mental health content, it's to consume it wisely. Mental health isn't trendy, it's personal, it's sacred, and it's too important to leave in the hands of an algorithm. So scroll with compassion, watch with discernment, and if something truly hurts or haunts you, don't just watch someone talk about healing, go start your own. You deserve that.